Hello, my name is Kate. I'm your student nurse today. Can you verify your name and date of birth? Great. I heard that the doctors talked to you briefly about your lab results. Do you have any questions about your hyperthyroidism? Well, yeah, an explanation generally. That is when your thyroid, which is this little butterfly-looking gland at the base of your neck there, doesn't produce enough of the thyroid hormone. That hormone affects a ton of operations in your body. That's probably why you've been feeling so low on energy at work. Maybe you've been having some trouble concentrating. It can cause all sorts of symptoms, weight gain, trouble thinking. It can cause you to be forgetful, your hair to thin. It can be constipation, even muscle weakness and cramps. It can cause depression, a bunch of mental health issues. So what they're gonna probably prescribe to you would be a hormone replacement therapy. So that hormone that your thyroid's not making as much of, they're just replacing it with a synthetic hormone in the form of a pill, which you have to take every day. The good news is most people do really well with hormone replacement therapy in terms of managing those symptoms. So it should help you with your energy levels, your job performance, and all that kind of stuff that we talked about before. Oh, how common is it? Pretty common. There's about 1 to 2% of the population in the US actually has hyperthyroid issues. Mostly women, mostly those over 60, so right about where you are, and those with family history of thyroid issues. Do anybody in your family have, oh, your mom and your aunt? Yeah, so that's probably a contributing factor. The good news, though, like I said, if you're keeping up with that treatment plan that the doctors will discuss with you, that thyroxine of the daily pill is really going to help that. Oh, yeah, your aunt does that too. I bet, yeah. Okay. Why? Oh, why? Yeah. Well, it can be caused by a number of different things. I don't know exactly what will be causing yours, but that's a good question. Most commonly, an autoimmune disorder called Hashimoto's disease. Other than that, radiation therapy. I know you haven't had any of that. An overreaction to hyperthyroid medication. It doesn't look like you've been taking anything like that. Or anybody that's had like a surgery or certain medications. You haven't had thyroid surgery, and it doesn't look like any of the medications that you're on might be causing that. So it could just be that family history. Yep. Yeah, so if you don't keep up with that pill, I know you're really busy at work, but if you don't keep up with taking that pill, the problem is that a lot of those symptoms that you're experiencing right now, and even some others, can come back and get worse. So things to look out for, if you for some reason should stop taking it, which I don't recommend, or if you're feeling like you are taking the pills consistently and you're still having symptoms, some of those symptoms to look out for, like I said, all that mental health issues, feeling depressed, run down, lethargic, having trouble thinking and concentrating, weight gain, hair thinning, all of those types of issues. You'd want to kind of talk to your provider about that, maybe to adjust the level of that synthetic hormone. Other kind of more serious issues that could arise. Some people have heart issues down the line with untreated hypothyroidism. Again, that mental health aspect can get a little bit tricky, and you can also develop a goiter. Have you ever seen those people with like this big kind of growth looking thing on their neck, that can be from thyroid issues too. So don't want to do that. Super important to keep up with that hormone replacement therapy. Okay? Yep. Oh yeah, usually it's called thyroxine. We'll see what your doctor's prescribed to you. They'll talk to you about that. Okay? Anything else? Nope. Yeah. All right. Great. Well, let me know if you do have any questions. Okay. Bye-bye.